Hi, I'm Kiefer Bass, and I'll be discussing a volleyball program Philip Richard and I created. This program is created for off-season training for female D1 volleyball athletes. The duration of the program will be a total of 32 weeks. Volleyball is a sport characterized by dynamic, explosive, interval-based movements that require technical skill and knowledge. The most common movements performed in this sport is various types of jumps, throwing motions, and short bursts of sprints. Common injuries in volleyball players, acute or overuse, occur in ankle, knee, and shoulder joints. Injuries are commonly caused by proper technique or overuse. Ankle sprains are the most common form of acute injury in volleyball. This usually occurs when landing onto another player's foot, often a player from the opposing team, so these are more common in positions that play around the net. Technical and proprioceptive training are effective methods of preventing ankle sprain in volleyball players who have suffered this injury 4 or more times during their career. ACL injuries occur due to excessive loading of the knee. Athletes that are able to produce a great amount of power when jumping are more at risk. Preventing this type of injury is difficult in volleyball because it is inherently a high-risk sport relative to the knee joint. Volleyball-specific overhead skills such as the spike and serve produce considerable upper extremity force and torque, which may contribute to the risk of shoulder injury. Limiting the number of jump serves may also reduce the athlete's risk of overuse-related shoulder dysfunction. Chronic overload from repetitive jump serving and spiking could contribute to the risk of shoulder problems. The physiological needs for volleyball players require anaerobic training, a well-developed creatine phosphate system, and a well-developed glycosidic pathway, along with increased heart rate and increased VO2 max. Volleyball athletes perform multiple and different types of jumps, including vertical and counter-movement jump. Testing over vertical and counter-movement jump will give a base level of how high your athlete is able to jump. The athlete will perform 3 repetitions of vertical jump, then 3 repetitions of counter-movement, utilizing a vertec to get accurate results. Athletes must be able to change direction while maintaining speed to adjust to the placement of the ball, and must be agile so the athlete can reach the ball in a sufficient amount of time. Athletes will be tested on pro agility to simulate similar actions when performing. 3 attempts will be given, each attempt will be timed. The pro agility test provides a measure of how agile an athlete is while testing perceptual and cognitive ability in relation to the sport. Athletes will perform 30 seconds of continuous jumps to test the anaerobic system. To test the aerobic system, athletes will perform a 20-meter shuttle run test. This test requires the athlete to increase speed between each rep while also giving the proper amount of rest time between sets. In the weight room, athletes will be tested over strength and power. Testing on squat will measure the strength, and power cleans will measure power. Athletes will be given 3 attempts to perform a single repetition for both tests. Core training will take place in all planes of motion. Throughout the program, intensity will be increased. Core stability enables athletes to control the position of their body and generate power through it. Athletes always begin in a stable position. Next, we'll be adding an external load, then progressing to shifting center of gravity. Starting in an unstable position, fighting to stay stable is the next progression. The last progression, starting in an unstable position and shifting center of gravity. For balance training, athletes are able to control their body by knowing how much space the athlete has due to visual proprioception training and vestibular system. For speed training, deceleration will be the first component trained. It requires the highest load and is the highest risk of injury. Acceleration will come hand in hand. Athletes will progress to a change of position in the body. This will be changing the stance of the athlete starts in, starting in a square stance and progressing to a staggered stance. Agility is a change of direction. We'll first train one cut, two cut, progress to multiple cuts, then progress to random reaction drills. Speed, agility, and quickness focus on increased rate force development and increased recruitment and rate coding. Plyometric training further develops explosive movements in the body. Each session, full body will be trained. Technique will be focused in the early stages and explosiveness in the later stages. Lower body plyometric training helps produce maximal vertical or lateral movements in a short amount of time. Upper body plyometric training, consisting of medicine ball throws, catches, and several types of push-ups, can help volleyball athletes develop throwing motions. In the beginning of the program, we will start with low intensity and begin to work towards high intensity exercises. Plyometric training is recommended in any training program to improve sprinting, jumping, and throwing capabilities. Resistance training improves overall strength in an athlete, consisting of high explosive movements, combining core strength exercises such as squat, bench, and deadlift, and Olympic-style lifting, power cleans, jerks, and snatches. Will provide improvement in maximum strength and vertical jump height in D1 volleyball athletes. Resistance training can provide prevention of common injuries in volleyball athletes. Volleyball athletes are constantly performing throwing motions. Shoulder injuries are often due to overuse. External rotation is extremely important when performing spikes and serves. Throughout our program, we will be focused on strengthening external rotators. Resistance training will consist of high-power training, Olympic-style training, strength training, focusing on core lifts, and accessory movements. Olympic style is utilized for high-power exercises to build strength and power and develop athletic performance. Strength is used to increase maximal strength and power. As maximal strength increases, jump height and throwing abilities increase. Accessory movements will provide growth and build strength in the isolated muscle. Each mesocycle phase will last up to 4 weeks with a 5-day split. One session will be a heavy day with high intensity and low volume. On the heavy days, the last set has a plus or minus symbol to test the athlete on how many repetitions they are able to perform on the last set. The next session will be a moderate day with a slight decrease in intensity and the same amount of volume. Last session of the week will be a light day, with decreases in intensity and a slight increase in volume. Each phase's last week will consist of a download week. Throughout the program, the volume will start out high, and as volume decreases, intensity will increase. The basic power phase will be focused on increasing strength, power, and stability in the body. This will be accomplished by high-intensity interval training, short interval training, and long slow distance training. Multiple cuts, pro agility, and W drill will be utilized to train agility. Plyometric training will consist of moderate intensity, jumping for distance, and explosive push-ups, consisting of 75 to 150 foot and hand contacts. Intensity will continue to increase 75 to 85% of 1 rep max. Volume will decrease to 6 reps. This phase will consist of a 1:3 work-to-rest ratio to train the anaerobic system. Max strength will be the next phase and train the anaerobic system as well. This phase will focus on increasing max strength and max power. This is done by repeated jump activity, lateral shuffle drills, and long slow distance training. Reaction drills, cognitive development, and random drills will be utilized in this phase to train agility. High-intensity plyometric training will consist of jumping for height and med ball throws, with 0 to 75 foot and hand contacts. The intensity will increase 80 to 85% of 1 rep max, while volume decreases to 4 reps. Max strength will consist of a 1:5 work-to-rest ratio. The last mesocycle is max power. This phase will focus on maximal strength and power output, utilizing sport-specific skills and increasing glycosidic to ATP to PCR. This is to prepare athletes for the season. Sport-specific reaction drills will be used for agility to simulate game-like situations. Plyometric exercises will be high intensity, consisting of high jumps, and high death drops. The sport-specific med ball exercises will be used with 0 to 75 foot and hand contacts. The intensity will increase 85 to 90% of 1 rep max, while volume decreases to 3 reps. In max power, the work-to-rest ratio will be 1:10 to continue to train the anaerobic system. I'm Kiefer Bass. Thank you for listening.